And here in Connecticut, infectious disease experts say there's almost no risk of people contracting Ebola, yet hospitals are still on guard. Fox Connecticut's Tony Terzi joins us with more on protective measures they're now taking. Tony.
Jan, Ebola is introduced to humans through close contact with the blood or other bodily fluids of infected animals. And while there's never been a case of Ebola reported in the United States, Connecticut hospitals are following federal guidelines closely. Centers for Disease Control and Prevention now requires hospital personnel, when suspecting Ebola or certain other communicable diseases, to subscribe to droplet and contact isolation.
For that, we will put on a gown, we'll wash our hands and put on gloves, and we will put on a mask.
In light of Ebola's prominence in the news, Hartford Hospital and its associated healthcare facilities are now employing what's called a triage identification system with all patients.
We ask questions: have you traveled? If you have traveled, have you been to the Middle East perhaps in the last 21 days?
21 days because that's the potential incubation period.
Have you been to the countries in West Africa, such as Sierra Leone, or Liberia, Nigeria, or Guinea?
A positive response to any questions results in immediate isolation. Now, the CDC announced yesterday that they'd received 68 calls from 27 states about potential Ebola exposures.
They were able to very rapidly rule out 58 of those as false alarms. There were 10 where they suggested testing. 7 are negative so far, with 3 the tests still remaining to come back.
An experimental serum was used to treat the doctor and aid worker who've now been released from Atlanta hospitals. And Dr. Ross believes pharmaceutical companies are already racing on 2 fronts.
One would be developing an antiviral drug for Ebola or for an anti-sera. The second would be the vaccine development.
Ebola outbreaks have claimed the lives of 90% of those infected since being discovered nearly 40 years ago. That was Dr. Jack Ross from Hartford Hospital. He is their chief of infectious diseases. Next hour.